Hi everybody, my name is Jessica Wooten and I collaborated with Jennifer Murphy on Margaret Newman's theory. We had number 4 and this was to provide an example of the theory as it applies to nursing administration and leadership. And then it's to identify the concepts to be used and how they could be operationalized. So Jennifer had went ahead and she found an article that's called Health is Expanding Consciousness Implications for Health Policy as Practices. So, this is the article we both read, and she did a nice little summary in the wiki. And on page 283 of the article, there is a figure 2 in it, and it is to get to that page. And it's called Health is Expanding Consciousness Praxis Protocol. And I'm just going to show you, here's the figure, everything I circled. So this is basically the protocol that they want to use to help build new policies and procedures by using Newman's theory and how they can improve them. So there's 7 sections. I'm going to go by and break them down a little bit, but I'm also going to use maybe a little bit of an example or a story or definition of what each one means to me for our patients in our community. So the article, I had already said it, and the article was written by Kathleen M. Muscar, RN PhD, and Paula N. Kagan, RN PhD, and everything is referenced in the wiki for the article. So I'm just going to give a little summary about the article. It's to incorporate Newman's theory of health as expanding consciousness. This theory is aimed at developing healthcare policies by using practice methodology and praxis method. The other goal is to create a framework for policy development as well as protocols. This article helps explore the possibility that theories can help guide and impact communities and enhance nursing knowledge with health and public policy. So the first one that it talks about is how to establish nurse-client mutuality. Mutuality with the patient, this helps create a safe haven for them and a balance between the patient and the nurse. This can help alleviate anxiety on the patient once you build that trust with the patient. I feel like that this also creates a good long-lasting relationship with the patient by keeping them informed about their diagnosis, treatments, answering any questions they may have, just really listening to the patient. I feel like this allows them to make more educated decisions about their plan of care. I feel like it's always important to be sitting at the patient eye level, listening intently, answering any questions clear, and no medical jargon so they understand you. The second was transcribe what the client says. So I feel like it's not only important during the assessment of our patients, documenting our objective findings, but I feel like the subjective part, what the patient is going through, what they're saying is really important. I feel like I'll give an example, like the patient's having any pain, by listening to basically what their precipitating factors are, describing the pain, where the pain is, that can help us break down and find out what is really going on, how we can treat and use different interventions for their pain, and communicating with the doctor. And I feel like helping them through that, communicating with the doctor, having the patient be a part of their plan of care, really guides trust in the relationship. The third one is to develop a chronological narrative, noting indicators of pattern shifts such as a natural break in the narrative. So I feel like when you're doing an admission on the patient, they give us their history and their physical. And I feel like when there is a chronic illness, and they're used to living their everyday lives with this chronic illness, but if something happens to break in this diagnosis and they have an acute episode, this can definitely have fear, anxiety in the patient. So I feel like this can be a little bump in the road for them. They could be fearful, not listening to what's going on because they're scared. So we're there to be there for them, listen to them, and help guide them. Um, I feel like when they're trying to tell their story or their history, they might be a little shooken up. So I think giving them time or maybe asking open-ended questions to them will help guide the right track of what we need to do to help them and put them more at ease. The fourth one is transmute the narrative to a diagram of sequential pattern configuration. So I feel like when you're explaining the patient's diagnosis or any kind of testing to them, this can cause confusion because they're worried, they're not in the right mindset, or maybe multiple people are coming in and out of their rooms, or they're getting too much information at one time. So really sitting back and maybe drawing diagrams or pictures to help them better understand, like if they're going for a procedure, how doctors always draw the pictures for them. Maybe if we can draw a diagram or anything to help them know what's going on in their bodies and how we're treating that, I think that gives a visualization and really helps them. I think this decreases stress and increases trust in our patient relationship with the nurse. And this also helps them really be part of their plan of care. The fifth one, it said share a diagram with the client for validation of changes of clarification. So I feel like, for example, patients with the new onset of diabetes that are taking insulin, especially our elderly patients out there, what I would do in the home when I would be their home care nurse is, I would explain the medication. I would make a table for them, and it would state with a black marker in large letters and numbers. I would put how many times a day they're to check their insulin before meals. Then I would do a large sliding scale for them, and I put it in the fridge. I put it on the fridge for them because their insulin would be in the refrigerator, and this would kind of be a reminder every time they go past to know when to check their insulin, their blood sugar levels, and they can use the sliding scale. And this really helped patients, I found out, because it was like a reminder for them. I also think giving demonstrations and return demonstrations would be a huge help when you're helping them draw up the insulin and the needle and where to, inject the insulin, things like that. I think that alleviates a lot of fear, especially if family member caregivers are also helping. Also, I feel like with like we'll say for incentives barometers, a lot of patients aren't really using them correctly. They feel like they didn't get enough education in the hospital. So you're always educating them on how to properly use them. And I feel like that's more effective when you're doing a demonstration, return demonstration, and then you reinforce that the next visit to see if they're really doing it and if they're improving. And then the sixth one says mutual reflections on the diagram pattern. Recognition may occur as insight. I feel like following up with the patient the next day, whether we're doing IV demonstration on the patient with their PICC lines, or whether, like I said before, with the incentive spirometer, if they're using it correctly, they may have more questions, or we can watch to see if they're doing the incentive spirometer correctly or the IV correctly. I think this also alleviates any fear or anxiety because they become more independent, more comfortable. We're there with them. We can answer more questions they may even have that they didn't think of before. I feel like this definitely enhances the relationship again. The seventh one is action potential emerges with pattern recognition and possible transformation occurs. Gaining trust with your patients and giving them encouragement definitely helps when educating them. I feel like documenting and observing correct technique by following policy and protocol through our jobs is extremely effective and very safe for our patients for their road to recovery. I feel like this also gives them more of a sense of independence. This makes them feel like they're really helping themselves and being really involved in their plan of care. So by I'd say applying nurse administration and leadership to the praxis protocols starts with us as administrators. And it is our job to teach our staff, our nurses, um, how to better educate our patients, making sure they're following policies and procedures correctly, and making sure our patients are safe. Feel like as administrators, if we're auditing charts, making sure the staff is following the protocol correctly, that our patients and documentation are effectively being treated, and if they're following compliance with what they're to be doing, we can go ahead and change any policy or procedure to make it more effective or safe if we see something or a trend that's occurring. This helps with our patients in the community by applying Newman's theory. I think it allows us to educate our staff and for them to go out and implement the best care to our patients. It always leads to us to help guide the way. And I feel like Newman's theory, really helps with, I think, being the baseline of adding into a new maybe policy or procedure. All of our patients that we mostly see have chronic diseases, and they are seen as a whole through Newman's theory, and they are just like everybody else. They learn every day to live their lives to the fullest. But when there is an issue and we are called and needed as their nurse, we can provide them the best care possible. Well, I hope you guys enjoyed this little video, and I hope you have a good day.